So I'm going to start with you. Will, in fact, the Affordable Care Act be fully repealed? Can it be fully repealed, in your view?
Yeah, I think it's pretty unlikely that it's fully repealed without an alternative. Over 20 million people have been added to the system, many of which come from states where Trump won, like Michigan and Wisconsin. In fact, in those states, before Affordable Care Act, more than 14% were uninsured, now less than 6%. So unless there's a viable alternative, I think it's highly unlikely. Furthermore, I think there are many aspects of the Affordable Care Act that will continue and flourish that healthcare investors have been investing in.
Lisa, you heard the views from Atul. You yourself are at the heart of helping modernize, make more efficient the infrastructure behind healthcare. Is this something that, even if it is repealed, would ever be moved away from, the efficiency search, the drive for it within healthcare in the US?
I completely agree with Atul. Many of the drivers, the market drivers for technical innovation, are not going away if ACA is repealed. The shift of cost to the consumer, the shift to value-based care that we're seeing that is led by CMS but followed quickly by the private industry, the private insurance markets, that's not going away, and that's driving a lot of what we're seeing in innovation today in the medical industry.
So the underlying factors are still there. Atul, does it change your opinion in the investability of some of the healthcare in terms of certain verticals within it? Because there is an element of uncertainty at this period in time.
There's definitely a level of uncertainty, and I think, if anything, it's causing a pause in the buying process and elongating sales cycles. But in the long run, I don't think this is going to be a big impact. I mean, lower cost, higher quality has been the mantra within the Affordable Care Act, and it's also within the Trump approach. And so, as Lisa was mentioning, whether it be payment or consumerization or even shifting the site of care, all of that will continue and maybe even accelerate. And even when you think about the digitization of the medical system, the stimulus had $30 billion that was allocated to move medical records from paper-based to electronic-based. And that's been the foundation for a lot of the new software and applications that are being developed to advance healthcare. And so I think innovation and disruption will continue within healthcare technology investing, regardless of how this shakes out.
Lisa, has it slowed your decision-making process in any way, the electoral changes and administrative changes that will come?
No, many of the bets that have been made to digitize the healthcare industry were made prior to the ACA and will continue. From our perspective, and here's the only point that I'll differ from Atul on this, is even with the economic stimulation, even with the adoption of electronic medical records, much of that's written on circa 1990 software. What we're really expecting to see from this administration and their commitment to investing in infrastructure is a commitment to modernizing healthcare in the US, really for the first time. That's what companies like PokiDok are devoted to. We're creating open software development platforms to bring these products and solutions to market quickly. Healthcare systems, private insurers, even CMS, they've made their bets. Those buying cycles are over for them, and they're starting to deploy on platforms like ours.
So Atul, what's the spectrum look like out there at the moment when you're analysing the environment? Who is the most interesting to be investing in? Which particular parts of the healthcare system do you think are the most ripe for disruption?
So the areas that we primarily invest in are at the intersection of healthcare and technology, where people are investing in software applications that enable higher quality, lower costs. And again, a lot of that, the foundation has been laid with the digitization of the medical records. And so we find that to be quite robust. I mean, we have companies like TigerTex that are within the clinical communication and workflow space, and their whole mission is to improve outcomes and lower costs, and they're benefiting from the trend that we're seeing. Even as you look at shifting site of care from hospitals to home-based care, where it's lower cost and patients like rather be, we have companies like Premise Health and Home Team where they're at the center of that. And so almost across the board, we're seeing still tons of innovation and disruption. But I think with any discussion about ACA repeal, there is some uncertainty created, and so we could see some pause in buying. We're seeing an elongation of the sales cycle.
Is that something PokiDok is experiencing when you're looking at your suppliers, those that you're working with? How have those sorts of sales discussions gone?
Truth be told, healthcare is probably the longest enterprise sales cycle known to man. Putting that aside, we haven't seen a slowdown in that sales cycle for PokiDok. At the same time, we have 10% week-over-week growth in emerging companies adopting, coming to our platform, signing up for our APIs, and building product in production today. So that hasn't slowed down. I do hear, and I certainly hear in the industry from other companies out there that they're experiencing somewhat of a slowdown. They certainly did as they were waiting for the results of the election. Now as we go in, I think most recognize that the ACA, that's not going to impact a lot of what they're doing today. It's certainly not going to impact the out-of-pocket cost to the consumer. That it's driving a lot of these innovations or new access models, but it will have some effect for sure.
And where's the competition when you're looking at startups helping provide these sorts of efficiency to the healthcare? I mean, they must be coming out of Asia as well as Europe. Is it only US companies that will be adopted by US healthcare providers, or do you think they'll go out further afield?
I think platforms like ours that provide an open software development platform allow companies from outside the U.S. to enter the U.S. market in ways they haven't before. The other thing it allows is other industries to start to insert themselves into the healthcare workflow, like financing, banks who want to offer financing to consumers who can't afford a particular procedure, or supply chain companies like Amazon who want to start providing different goods and services, durable goods to healthcare. We're going to see a lot more of that as we come into this year and as there is a modernization and move to the cloud across the industry.